So let me illustrate this with a drawing. One of the things that we always start with is the patient's story, because complexity is about stories and patient relationships, and really identifying what the patient's story is helps provide a context and some embeddedness into what their situation is. So if we had Mr. Johnson here, who had a knee replacement, he is really suffering from anxiety. He probably has got impaired mobility. He's probably got pain. He's probably got self-care deficit. He might have some risk for infection. He might have some self-image, body image issues if he's got some of these things going on. These are the nursing care consequences of his medical condition or his surgical. So as you begin to do some sense making about this, complexity kind of informs your thinking, because you can begin to ask yourself, well, what is the relationship between anxiety and impaired mobility? And so you have to really kind of clinically reason, and it sort of takes the structure of, I'm running out of ink here, if then, since so. So if anxiety is high, then what would be the consequences for impaired mobility? So the greater the anxiety, maybe the less the mobility. Or you begin to kind of go around the circle and you look at all of the different functional relationships. What's the relationship between impaired mobility and pain? If somebody has great pain, they're going to be less likely to move. And so there is a relationship there. What is the relationship between pain and self-care deficit? If you're not feeling very well, you're not feeling comfortable, you're probably going to have lower amount of self-care deficit. And so as you begin to sort of make these connections in relationship to going around the circle, it can get very complex as you begin to consider all the possible permutations of these things. So what would the relationship of pain and anxiety? The greater the anxiety, the greater the pain, or the greater the pain, the greater anxiety. And so it becomes sort of a little game to sort of make sense out of all of this. And the reality is what's the relationship to anxiety and body image? You know, the greater the anxiety, the greater maybe body image disturbance. Risk for infection and impaired mobility. What's the relationship there? So you begin to sort of see all of these dynamics working together, and pretty soon you begin to find a leverage. And my guess is with Mr. Johnson here, right now we have several issues here pointing to the area of pain, which becomes the keystone issue. And if you think about the system dynamic and the complexity of this, if we fixed Mr. Johnson's pain or helped him develop some comfort measures, is it likely that he would have more mobility? Is it likely that he would have less anxiety? Is it likely that he could take better care of himself? Is it likely he could get up and move around and be at less risk for infection? And is it likely that maybe some of his body image and self-image issues might be resolved if he was comfortable? And so this is sort of the systems thinking that's involved, I think, in clinical reasoning, but considering the complexity of the relationships between and among all of these nursing care diagnoses is really where you evolve into complexity thinking. And so in reality, I'm a firm believer that when you're clinically reasoning, you've really got different kinds of thinking going on. There's critical thinking, because it takes critical thinking to even identify what some of these nursing diagnostic categories are. It's creative thinking, because you're sort of putting them together in a new and different way. It's systems thinking, because you are trying to kind of understand the system dynamic and the causal loops and the nested kinds of sets of relationships that are embedded in here. And it's complexity thinking, because you're kind of framing the whole thing in terms of your relationship and your ability with helping Mr. Johnson get his nursing care needs met. Now, the other thing that I kind of want to point out here is most of these are problem-oriented, because nursing diagnoses are problem-oriented. And the secret here in terms of complexity and creative thinking is that you really have to kind of figure out what the opposite of these issues are in order to identify a well-formed outcome. So the opposite of pain, I sometimes ask students, what's your outcome? And they say no pain, but that's not a very good outcome. The opposite to pain is pain control or comfort. And so you really kind of have a complementary pair here, which again is a kind of a complexity-inspired approach that Scott Kelso talks about, the complementary nature, that everything is bipolar and everything contains its opposite. So wherever you have pain, you have the complementary pair of comfort. Wherever you have anxiety, you have the complementary pair of anxiety control. Wherever you have impaired mobility, you have active mobility. And so thinking about these things in a creative way requires you to kind of understand the complementary nature of both the problem and the outcome that you want to move towards in terms of your understanding of the system dynamic as you reason clinically about these patient care problems and issues.